I am the best doctor. I'm Dr. Greg Romriell. I'm from Pocatello, Idaho. I lived many years in Pocatello and Chubbuck, and I love this place. I started in dentistry in 1970, actually 1969, and I started SmileMakers in I think about 2003, 2004, can't even remember. But Dr. Ormond and I had been part of Pocatello Dental Group, and when that ended, we decided he and I wanted to still practice together. So he said, "What should we call it, Romriell and Ormond?" And I said, "No, I want to have something that people can think positively about and identifies who we are. If you hear Romriell and Ormond, is that an attorney office or a business? That doesn't mean anything to anybody." And I had a list of 10 names I had come up with. And everybody I knew, I said, put a check mark by the number one name. And SmileMakers won 9 to 10 out of 10 times there. And so that's how I came up with SmileMakers. And the rest is history. It's a name that people hear and they remember. It's not associated with pain. It's not associated with economics. It's associated with smiling. And when that's happiness, that's joy, that's enjoying life. I'm excited. One of my primary concerns when I was getting to the point of retirement was having someone to come in and could take care of my patients with the same quality of care. And I did not want a young doctor to come in, no matter how good he is, they never quite have the skills. They've got a ways to go. The practice of dentistry is just that, and the longer you practice, the better you are, the better you get. And so I was always afraid, and I had many young men come in, good men that wanted to come in and become associates, but I never accepted it. But where Paul, that was not the case. He was not a young doctor, a fresh out of the box doctor. He had graduated from dental school. He went on to postdoctorate school, which is another 4 years, where you're doing very intensive, challenging, difficult dentistry that most dentists can't do. And then he practiced for several years over in Twin Falls, so he perfected those skills, those things that I was concerned about. And so I was excited to have him buy the practice or take over the practice. So no, I'm very pleased with what he's done with the office and how he's perpetuated the quality and care. And I've talked with many patients that were my patients before that are still at the office, and everyone has been very satisfied, very happy with the care that they've received over there. I really don't know what was the inspiration for it. When I was 14 years old and I received my Eagle Scout border review, I was asked, "What do you want to be when you grow up?" And I popped out, "I want to be a dentist." And then, that sounds really cool. It sounds cool to be a dentist. And then I just started paying attention to dentists and lifestyles and what they did. And I've never wanted to be, since that point in time, anything else. I tell people when I say I'm going to work, I'm really telling a little white lie. I'm not going to work. I'm going to play and be with my friends. Hey, when you graduate from dental school, you don't know how to do more complex dentistry. By complex dentistry, we're talking about replacing teeth, replacing jawbone, replacing gum tissue, replacing structures that have been lost from trauma or from disease. How do we take those lost structures of your physical body and make them work in a normal, natural, functional, comfortable way? And that's what Paul has learned to do. He can take a debilitated mouth that has been destroyed from neglect or accident and restore it back to its optimum function. And there really aren't very many guys that can do that. I think the success of a practice has to have that behind it. Your skills are assumed, whether you have them or not. Everybody assumes you have it because they're incapable of judging the quality of work that you do. The only way the patient can judge you is, did they hurt you? And people know if they got hurt or not. And they assume if you hurt them that you're doing something wrong. You're messing up, whether it's reality or not. But they know how they feel. They know how you make them feel. They know if they feel you're concerned for them. And people don't really remember specifics of events, but they will remember how they feel about that event. And I think the direction that you're going, putting that emphasis on feelings and emotions, is really critical for the growth of the practice. The practice will not grow unless you get new patients. And you don't get new patients unless you have patients that are talking about what you're doing and talking to their friends. Yeah, you can put your name out there. You can put SmileMakers on everybody's corner lot, and it doesn't mean anything to anybody until they need a dentist. And then they're going to talk to their neighbor and say, gosh, I got this tooth problem. Who do you know will take, oh, SmileMakers. They did a really good job. I really felt good about it. And so, yeah, you're absolutely going the right direction.